Hello, we're going to try this again. I apologize if you guys keep coming on and we keep starting and then stopping. We're having some technical issues trying to get Seth on and connected. And then, so hopefully we'll work now. I'll wait for him to show up. Functional Fridays are what we're trying to do here with Facebook Live. We've been doing our podcasts out at the Gaslight once a month, but with summertime, it's a really hard time to find Sundays that are working well. So we kind of figured let's head into this concept over the summertime and try and pull some people in and bring some. Here, I got you. Should be getting at it. Yes!
Got it.
Oh my gosh, it's like we did this.
Everyone can go home now. All right.
I know. You know, this is what I tell everybody. I have coaching clients still that I see every once in a while. And one of the things that I always talk about is I'm an advocate of doing Facebook Live because you just put it all out there and it's not always going to be perfect.
It's very true.
Welcome. We started Functional Fridays as a way and an opportunity to bring in some experts who use food as medicine or use food as a component in helping heal their patients. And then I would like to kind of dive into some other areas. Functional medicine is like this it's not a new thing, but it's a new term and that is being used and people are starting to seek this out. Can you explain, well, first, say who you are, what your practice is, where you're located at, and we'll kind of start diving into some of the questions then.
Awesome. So first off, thanks for having me, Becky. I love what you're doing with these Facebook Lives and getting the word out about natural health, food as medicine, because this is what's really going to take it to the next level. And especially in St. Louis, you guys are making a big splash, which is awesome.
Thank you.
Anyway, I'm Dr. Seth Gerlach with Core Health. I'm a board-certified chiropractic internist and a functional medicine practitioner. Our practice is in the University Club Tower in Richmond Heights, right across from the Galleria. So we want to talk about functional medicine today. So when people ask me what functional medicine is, what I usually say is usually three different things. One, functional medicine is the medicine of why. So usually today people go to the doctor and they say, I've got, this symptom, this symptom, this symptom. So the doctor's looking for what? What disease is it? And then we match what disease with what drug. So it's usually, symptom A, drug A. So functional medicine asks why. Why do you have those symptoms in the first place? Why do we have high blood pressure, high cholesterol? Why is our thyroid off? Why are our hormones all out of balance? Instead of just covering something up, it's about getting and finding the root cause. And you talk about food. We'll talk about that, I'm sure, a lot today. Food is a big, big cause of a lot of people's problems. Secondly, it's a systems-based medicine. And this has been around for decades. It's nothing new. But like you said, it's gaining tons of traction because people are getting better and they're staying better. And when you look at the systems of the body and how those are connected, so, gastrointestinal system, cardiovascular, detoxification, all the different systems, hormonal, and look at how those are functioning. It's way better than looking at and chasing the symptoms like we talked about, right? So we look upstream instead of just waiting for symptoms.
I'm going to pause for a second. Why? Yeah. What? Because this just makes sense in regards to why wouldn't doctors be doing this? Isn't that what a doctor is supposed to do is help you fix the situation? Where was it ever like that with doctors? When did things change? What's your take on that?
That's a good question. I think it was a long, long time ago where we used more herbal formulations and food and things like that. And around, the early 1900s-ish is where conventional medicine, the medicine that we know today, has really took hold and perpetuated ever since. So the early 1900s, the biggest thing that killed Americans were infections. So pneumonia, typhoid, all those infections that, we don't see a whole lot of today anymore. But conventional medicine got into using more pharmaceuticals, antibiotics, things like that. And we really kind of used that model ever since. But now today, 21st century, we've got different health problems. 7 out of 10 people will die of a chronic disease. This is things like diabetes, heart disease, cancer, even autoimmune diseases. And they're multifactorial, meaning there's many different things that can cause someone to be sick today. So you can't really fix it with one pill. It's not like you just can't make someone healthy by giving them a medication, because their illness or disease could be caused by 10 different things. So it's hard. But that's why people are flocking to natural health, eating better foods like you guys have, to naturally minded doctors to see what the heck is wrong with me. People are frustrated. I don't know if you see it every day. People are really frustrated with the conventional medical model, and I don't blame them, because I've been through it.
Yeah.
When I was a teenager, I was on 5 medications.
Yeah, I was going to say, can
sure.
you share your story? Because I always think that it's interesting, and most of the time it's a really personal story as to why somebody winds up heading down this path. So what's your story?
Absolutely. Yeah, so mine started when I was a teenager, age 13 or so, and I started having terrible pains all over my body, neck pain, back pain. So we'd go to the doctor, physical therapist, run some x-rays. I don't know what's wrong with you. Here's a muscle relaxer, and here's a pain pill if it gets that bad. Okay, age 15, a couple more years go by. This has started to keep me from playing sports and things like that, which is really important to, a young boy at the time. So age 15, I started having headaches, which progressed into migraines, terrible migraines that would keep me, locked up in a dark room, have to sleep it off. Anyways, we're back to the doctor. Let's see what's wrong with you. Well, we can't really figure anything out. We'll give you 2 medications, one to prevent migraines, and then when you get migraines, you can take that one too. I'm like, geez, all right, keep on going. Another year goes by, age 17, on my birthday, actually, I start getting vertigo. And if people out there who experience vertigo, you know how terrible it is. It's just a sensation of the whole world is spinning around you, and you can't control it at all. So at this time, we're a little freaked out, a little worried. So now we're going to multiple different doctors all across the state, neurologists, MDs, DOs, everything, doing MRIs, CT scans. Can't find anything. I'm as healthy as a horse, they say. There's nothing wrong with you. So here's an antidepressant because you're probably depressed. Yep. So
What?
still on this journey. As time goes on, my energy levels are going down. Brain fog is starting to set in. I can't really play many sports at all. It's starting to affect like my mood, my home life, family life, things like that. And then age 18, I get hit with a really bad wave of depression. Who knows if it's from the medication or not. And terrible gut problems, constipation, diarrhea, and anxiety, kind of all at once. Yeah.
So they give you another medication?
Exactly. So at this point, we're going back to the doctors, and at this point, they're just throwing everything they can at me. But no one knows what's going on. And so my brain's like, well, so we can't fix the problem, so we're just throwing a bunch of medications at it. So what's it going to look like when I'm 30, 40, 50, 60, and my medications just keep piling up? So thank goodness I got hooked up with some great natural health, naturally minded people in my community that kind of pushed me towards, I went to chiropractic school, went there. Chiropractic school is not easy. It's a very taxing on your adrenal glands, your hormones, your gut, everything. Didn't make things better.
And it's expensive on top of
that too. Don't remind me, Becky. Thank you. Yeah.
I have these conversations with chiropractors all the time. Oh my
gosh. It's insane. It is very insane. So from there, I was still a wreck, but I got hooked up with these functional medicine doctors, and they were telling stories of how, they're reversing autoimmune disease and reversing heart disease and diabetes and cancers even and things like this. And I was like, man, that sounds amazing. That's what I want to do. So I went into functional medicine, dove in head first. What happened, I started seeing the changes in my body when we started figuring out all these problems. So I ended up losing 55 pounds, which is amazing. I was off all my medications. And today, as we sit here, I'm the healthiest I've ever been. And I think I'm getting better every day, Becky.
Yeah, well, you look great.
Thank you.
I don't think I ever knew you when you were sick. So yeah. I don't have anything to compare it to. Can you explain a couple of the things that that helped you transform? Like, what were some of
Sure.
those healing components?
Sure. Food was first and foremost for me, as is for most people, I think. The most powerful thing you can do for your health, I usually say, is what you put in your body. So the foods you eat. And I grew up, I ate crap, SpaghettiOs, mac and cheese, Pop-Tarts type thing,
The
As
typical high
yeah,
school boys diet.
for
Yeah.
sure. Some Cocoa Puffs in there too, just to get some milk for my bones, right? Yeah. But anyway, when I started changing my diet is when I started seeing some changes for sure. Weight started coming off, energy started coming back. So switched to a whole foods diet. Really nothing crazy, but limit processed foods and grains and sugars, eating more high quality meats and veggies, fruits, nuts, and seeds pretty much. I mean, a lot of people make food and dieting hard when it doesn't have to be.
Yeah.
But that was a very big one for me. And finding these root causes for me and my body, which is what functional medicine is all about. So we found I had tons of problems with my gut. So I had, and this is gross, hope you're not eating right now, but I had parasites, other bad bacteria. I couldn't digest my food at all. So everything I was eating was kind of just going through me.
Yeah.
Also had a lot of inflammation in my gut. So once we found all that out and kind of cleared up the gut, man, I saw some really, really big changes because when you can digest your food, turns out you have a whole lot more energy. Your brain can work well, and everything like that. Hormones were way out of whack. When the adrenals kind of topple or go out of balance, it kind of throws off all your other hormones also. So we found that rebalancing those was key. Detox was a big one for me. So inherently, some people can detox pretty well, some can't. Guess what? I couldn't. So that's
Okay,
something I still work on.
so explain detox. When you're
Sure.
saying detox, what exactly are you meaning? Because there's
Yeah.
lots of detoxes out there, but
Yep.
what are you talking about specifically a gut detox?
Not necessarily.
Okay.
So I look at the body's detoxifying every second of every day, or it's trying to at least. We can either help it or hurt it. And we're exposed to more toxins today than any other generation in history, by far. So since World War II, over 100,000 chemicals have been released to our environment, so our air, our water, and our food, just to name a few there. So the liver is the main detoxification organ, but we can get rid of toxins via our skin, so sweating helps. Urinating, so drinking lots of water helps flush out our toxins, and then through our gut also. So those are kind of the three main ways. So when your gut's backed up or damaged, you can't detoxify very well. If you're not moving, exercising, sweating, you're not going to detoxify very well either. If you're not drinking enough water, if you're dehydrated, you're not detoxifying. And there's other genetic components too. And of course, if you're exposing yourself to toxins, maybe you've got toxic deodorant or makeup or perfume, or maybe your laundry detergent's toxic. All these things add up.
And you just
Sorry.
froze up.
Yeah.
Like you just froze up for a second, but
I'm
you're
back.
right back. This
I'm
is
back.
perfect. You're good.
Anyways, so I say it's like everyone has a bucket, right? The more toxins we throw in it, the quicker we become toxic. So one, you have to get rid of your toxic lifestyle. Two, you have to help your body, your gut, your liver detoxify. It's through food and other nutrients mainly.
Okay. And so I think that part of the reason that I'm so intrigued in pulling on more functional medicine doctors is because at the restaurants, we get people who come in and they're suffering. There was one woman who sent me a message because she was sitting in our St. Charles location. She had noticed, or she was having some hormone issues. She started eating a certain way. They told her to just cut out gluten and sugars, and she was doing that, and she was finding some success, but she wasn't she wasn't feeling fully better. And she overheard me having a conversation with somebody else, and I said, we started talking about autoimmune. And she's going, what exactly is autoimmune? And I'm explaining, she was just seeing, I believe, a regular physician, and this physician was at least helping her transition out of gluten and sugar, which is not normal in that mold. But she overhears us talking about autoimmune and AIP, and she's going, what is this? Who does this work? And we're able to then give her some resources. And she went to go see one of these doctors, Dr. Olivia, who's out in O'Fallon, close to her. And she sent me a message and she said, she put me on an AIP protocol and it's changed my life. So
That's great.
It's fulfilling for us, but we're sitting there going, there are more and more people seeking and looking for advice. And we're not the doctors, we're not the experts in it, but I love knowing that we have those connections and can help people. And I met you through, you were doing your internship with Dr. Eddie Weller,
right?
Who's an upper cervical chiropractor, which is another unique way of doing chiropractic care. Now, do you do chiropractic care, or are you strictly functional medicine right now?
I do very little chiropractic care. I'm mainly focused on doing functional medicine.
And then do you refer people out? Is there like this entire scope of different people to help you get on a health track, or can you work with one and then it's just certain areas that you refer over? What's your patient going through?
Yes.
How are you working with them?
Yeah, it depends. There's so many different things, and we've got so many different people in town that we love, and you guys are one of our resources, just because you have such clean food. And I know if I'm going to send someone over, they're going to get the best quality food that's going to heal and nourish their body. But the other thing would be, great chiropractors. Dr. Eddie Weller's great. There's some other great chiropractors in town. I also have a chiropractor in my office also. So musculoskeletal and on the neurological component also, that can be a very big part of healing. I also send people out for psychological things. So sometimes people have like either mental blocks, they're not getting better. It could be, some of their thoughts or things like that, or their emotions that are really just holding them back. Acupuncture, things like infrared saunas, the IV therapy. The list goes on and on. Like, how big of a health team do you want? Type thing. Because the possibilities are endless today, which is great. Like, all this stuff wasn't around, 20 years ago. Now it's mainstream, which is awesome.
Right. And I'll have to make sure I connect you with Stacy with Soul Sweat.
I know Stacy, yeah.
Yeah. Are you familiar with her Soul Seeks?
I don't know.
Okay, so Soul Seeks is going to be a directory and a resource website for people to go on and find all of these different people and connections with, where is an infrared sauna? Where is a functional medicine doctor close to me? So if you know Stacy and Stacy talks to you, well, that needs to happen. So it is a directory, and we're going to have that linked onto our website as well. I have a question because I noticed this on your website. What's a hyperbaric oxygen?
Oh, Becky, you got to come try it out.
I know.
You got to come try it out.
We'll videotape it. Can we?
Sure.
Can we do a video of it? Okay.
Absolutely.
So explain it. What is it?
So what is it? I'll explain what it is, and then we'll talk about what it does. So what is it? It's a soft shell chamber that you can climb in, and it inflates around you. It's kind of like riding up in an airplane. So a couple things happen when we're in here. We get 95% pure oxygen breathing through a mask. Okay. Right now we're breathing about 21% oxygen. So oxygen is the universal nutrient that all the cells in our body need to heal and repair and function as they should. So when we're in a hyperbaric oxygen chamber, you're not only breathing more oxygen, but that oxygen diffuses from the pressure all over to the nooks and crannies of your body where it needs it, especially the brain. So it's really great for any kind of brain traumas, concussions. We've seen kids with autism, ADD, ADHD, all the way up to elderly people with Alzheimer's dementia. So what it does, and some of the benefits are anti-aging. So the more oxygen we have for our cells, the slower they can age. Stem cell production. So stem cells are the cells in our body that can kind of go and become anything, make anything. The more stem cells we have, the more we can heal and repair. So one study showed that after one treatment of hyperbaric oxygen, the stem cells in your body double, which is crazy, right? But even cooler, that on that study, they showed after a round of treatments, your stem cells increased 8-fold. So that's the healing, rejuvenating capacity and power of hyperbaric oxygen therapy. It's also been shown to decrease inflammation, improve circulation, great for the brain, boost your white blood cells so your immune system has more ammunition to fight off viruses, bacteria, bugs. That's why we see Lyme patients in here too. It does so many cool things. We've had professional athletes that are trying to heal and recover quicker, to get back in the game, back in the ring, whatever. So it really, we've seen kids, I think youngest was 6 months, and the oldest I think was in their 80s. So
Oh, wow.
everyone in between. Yeah.
So there's still hope that I could.
Still hope for you,
Smart.
Becky. Yeah, absolutely.
Yay. This is exciting. Does somebody notice the benefits immediately? Like one session and you walk out and you feel different, or does it take a series of sessions?
Great question. Yeah, some people do. And it's usually the sicker you are, the sooner you see results. Usually if you come in, you're like an elite athlete with nothing else wrong, you may not feel a big difference, you know. But the more sicker you are, the more inflammation we have going on, usually the quicker we see results.
Okay. Well, that's always helpful because this is one of the things, like everybody always asks, what kind of dietary restrictions am I on? Or what am I allergic to? Why did you create this restaurant like this? And the reality was that I don't have any major health issues. Food isn't a major component. Now I have a long background in studying and working with naturopaths. I'm certified in colon hydrotherapy, went to massage school, all of that kind of stuff. So I've always been intrigued by this. And I think that this is why there's more functional medicine doctors starting to show up, and there's a need for more.
Right.
Is because people are seeking out and starting to understand how food is playing a component. I got way off kilter this last year. I was eating and not caring about anything.
Yeah.
And I finally decided, no, I need more mental clarity to get to wherever the next level is. And so I cut out all gluten, all sugar, and really cut back on the alcohol drinking.
That'll
and
do
literally
it.
In just 1 week, and I'm talking about somebody who has no major health concerns or issues. In 1 week of eliminating all of those components out of my diet, I felt like a completely different person. It was like
amazing?
there was a mind fog that I wasn't aware that I had was gone.
Yeah.
So I think it's important to sometimes just test it, immerse yourself into something for a week and see what changes, because we're all affected in some shape or form. And the older we get, the worse that it winds up.
Yeah. So many people don't realize how big of an effect food can have in their body and how they feel. You know, they just don't know. So most people think that food is just calories. Like, oh, my body's just a car. Food's my gas. It just keeps me going, right? It's totally not true. Food is information for your genes, I tell people. It can turn on good genes or it can turn on bad genes. You do that with your fork 3 times a day with what you're putting in your body. Are you creating inflammation and disease, or are you creating health and wellness?
Right. And one of the other things that I noticed is I just heard footsteps coming down, so I got thrown off for a quick second. I think this is the other thing too, is that as healthcare is increasing, health insurance is increasing, prescription medication is increasing. People are getting to a point to where they can't. Yes, it was easy to go see a doctor and get a script written out and then go fill that script and have that temporary result from the medication. But people are now starting to see they can't afford that. And as they can't afford that, what are their other options? And functional medicine is one of those options.
Right. I say it's the best cost-effective measure you can do for your health, because think of it this way. The average heart attack costs about $760,000. The average rate for chemotherapy is $10 to $30,000 a month. The average diabetic is going to spend $14,000 per year as they grow. Every year they have diabetes. So we spend, 86% of our healthcare costs in America are spent on chronic diseases. So preventable diseases, pretty much, let's say. So with functional medicine, if you can find the problem, fix it, and then you don't have to take these medications or go to the doctor or get these expensive procedures, think of all the money you've saved, not to mention how good you feel, how much better your relationships are, how much more productive you are at work, how better you are with your family. I mean, for me, it's just such a no-brainer that it's hard for me to think otherwise now, you know?
Yeah.
But it is frustrating because, like you said, insurance premiums are going up, reimbursements are going down. People are struggling. They're struggling big time. But there's help. There's so much more help today than there was, like I said, 20 years ago.
Yeah. It is the biggest reason that we're creating this platform, the Functional Fridays, because I want to introduce people to these resources that may not be on their radar right now.
Yeah.
And hopefully by us giving out some valuable, good content and connecting people via this way, they can seek some advice out and change the way that they can function through life. So we're going to go ahead and wrap this episode up. I want to thank you for joining me today. This is going to be downloaded and then archived onto our website as well for future, for anybody who wants to. Can you tell us, Seth, how somebody can get a hold of you? And also then put your website into the comments afterward as well.
Yeah, easiest thing is our website, and I'll put that below, but it's corehealthstl.com. There's so much information on there. You can even book appointments on there, sign up for a free 15-minute consultation. If you're new to functional medicine, you don't know what's going on, and you had some questions, and I can help you answer those, hey, let's do that also. But I'll put the website below, and that's the easiest way to get a hold of us.
Okay, perfect. And in June, you're going to see an event that we're going to start popping up once a month at our Chesterfield location. We're going to call it our Healthy Hour. And
Nice.
we're going to lot out 2 hours of time, pull in a guest speaker. Dr. Olivia is going to be our first one for this. And her whole topic is going to be on why we need more functional medicine doctors here in the St. Louis area, where so many people are thinking that it's oversaturated. And the truth is, no, it's not.
Nope.
We need more. And
Yep.
then for those that are coming in, the 3 takeaways that we've asked for is the 3 questions you should be asking every doctor before deciding whether they are the right fit for you or not. So this is going to be a way to connect not only doctors with other doctors as resources for things that you can refer your patients out to, but also for the patients to come in and see these doctors and have an opportunity to connect and talk as well. So you're going to see us doing all kinds of things in the community, doing some more outreach and connecting people with more and better functioning life. So thank you, Seth. And I'm going to come in there and try this hyperbaric oxygen therapy here soon.
You do that. You do that.
Okay.
Thanks, Becky. You rock.
You're welcome.
Everything you're doing, it's amazing for the people of St. Louis. So keep it up.
Thank you. I appreciate it. And we will see you soon.